Hello, everyone. My name is Denise Bertasia. I am the Orthopedic Program Coordinator at Robert Wood Johnson University Hospital at Hamilton, and this is our Total Joint Replacement Pre-Surgery Education class for the Center for Orthopedic and Spine Health. We are Joint Commission certified in knee replacement, hip replacement, and spine surgery. We are the only hospital in this region of New Jersey that actually has all three distinct certifications from the Joint Commission. We have been certified in hip and knee replacement since 2012 and spine surgery since 2014. When you come to the hospital, you meet our dedicated orthopedic team, which is comprised of myself, the orthopedic coordinator, the OR and our surgical team, our inpatient orthopedic nursing team, rehabilitation and physical therapist, case manager and social worker, pharmacists, and dietitians. The objectives of this class is to help you better prepare for your surgery, know what to expect during your recovery, know what kind of things that you need to bring to the hospital and items that you should leave at home. You're going to learn about the role of the case manager and the social worker, learn more about physical therapy first in the hospital, and then the plan once you are home and are discharged. You're going to learn the importance of nutrition and how to order meals while you're in the hospital. Learn about common medications that are ordered after joint replacement surgery. And finally, you'll learn more about our pain management. So we're going to begin with the surgery time and details. The hospital will be contacting you the business day prior to your surgery. We call patients between 2 and 6 p.m. to let you know what time to arrive at the hospital. If your surgery case is on a Monday morning, we will call you the Friday afternoon, so the Friday or the business day prior to your surgery. You are to report to the outpatient registration building. It's also labeled Building 5. There is surgical patient parking that is nice and close to that door. You can have someone drop you off and pulling up under the underpass, or parking lot C is probably closest to that area. When you come in, you want to bring a photo ID, your insurance card, and an updated medication list. Now, I'm aware that you've given the nurses in your pre-admission testing phase a list of the medications that you take, but at times your medical physician or your cardiologist may have asked you to stop or continue taking certain medications. So we want to make sure that those medications are listed on this sheet and what you have stopped, and please put the date on that list of when you stopped a medication. Once you have registered, they'll give you directions to get over to the OR area. We actually have 2 operating rooms here in the hospital, one in that same building, so you'd have to go up to the 2nd floor, and one that we call Surgery North. So they will direct you as to where your surgeon is and where your surgery will be performed. At this time, one family member can come in with you. They're going to have their temperature checked, be given a mask, and then you'll be given directions on how to get over to the operating room space. Once you arrive to that operating room space over at Surgery North, there'll be a telephone on the wall and there'll be an extension that you need to dial. Just let the nurses know your name and that you're here for surgery. They'll have you come back first, get you changed into those lovely designer gowns that we have. They'll be asking you the same questions. Everyone you meet will ask you your name and your birth date and take a look at your name band. That's just a safety mechanism that we have in place to make sure that we're giving you the correct information and that we're speaking to the right patient. Once you're settled and in your bay, your contact person will be able to come back and sit with you. At that time, you'll see your surgeon. Your surgeon will be verifying the surgery that you will have done, and they'll actually take a special surgical marker to label the extremity that you have done. They'll either write a yes or their initials. You'll also meet with anesthesia. Anesthesia wants to talk to you about the different options that we have for anesthesia. For these types of surgeries, most patients receive a spinal anesthesia. Now, along with the spinal, you are completely asleep during the procedure. There are some patients that are contraindicated or not able to have the spinal procedure. Anesthesia will discuss that with you at this time. Once they've given you all the education and information, you'll be able to decide on which type of anesthesia you'll have, and you'll be signing for consent. You'll meet the rest of the OR team, and then it'll be time to go into the operating room. At that time, your contact person will be escorted over to the waiting area. The LFT1 or Lakefront Tower 1 waiting room is adjacent to the orthopedic unit. The patient will go into the OR. Any type of anesthesia will begin in the sterile environment of the operating room. You will be placed on monitors and be given medications to be put to sleep. The average procedure time for a total hip or total knee replacement is about 45 minutes to about an hour and a half, depending on your surgery and depending on your surgeon and depending on how much arthritis you may have. Once your procedure is complete, an OR staff member or your surgeon will be calling your contact person to let them know that your surgery is complete and how you did. Once your OR procedure is done and your wound has been closed, you will be moved onto an orthopedic bed, which is moved into the recovery room. In the recovery room, you're continuously monitored by a nurse. They're monitoring you for pain, for nausea, and they're also watching your vital signs. The average stay in the recovery room is approximately 1 to 2 hours. When you're ready to leave the recovery room, the nurse from the PACU gives a nurse from the orthopedic unit a call and will give them a full report. This is what a picture of the average room looks like. Our orthopedic unit is a 16-bed private unit. The nursing staff wears a vocera or kind of like a speakerphone around their necks. They're able to contact each other as well as physicians are able to call them on those phones. The charge nurse, Katie, and myself, Denise, will give you an extension that you could call us directly as well. There's a call bell in every room, which you can actually indicate whether you would like to speak with your nurse, whether you need pain medication, or whether you need assistance to the bathroom. We require that every time you get out of bed, you call one of the nursing staff members to assist you. I realize that you may feel great and you may be ready to get up and moving, but we need to ensure that you're safe. You may be connected to an IV or these compression boots that are on your lower legs. So we want to ensure that if you're getting to the chair or to the bathroom, that you're able to get there safely. The nurses will also teach you about your incision and your wound care during your stay, so you know exactly how to take care of your wound when you're discharged. So what should you bring in when you come into the hospital? The clothing worn into the hospital should be comfortable and can be the clothing that you're discharged in. If you're having a hip replacement, we recommend a larger pair of pants, ideally with an elastic waist. It's usually most comfortable. If you're having a total knee replacement, you want to make sure that the leg of the pant is a little bit loose fitting so that you're able to pull it up and visualize the knee if we need to take a peek at it, and that you're also able to fit it over your knee dressing. We ask that you wear safe shoes coming into the hospital so you can be wearing those same safe shoes to be discharged, ideally a boat shoe with a rubber sole or some type of sneaker. We will provide you with the hospital non-slip socks while you're here. You are able to bring your cell phone when you come into the hospital. Please don't forget your charger. There is no charge for the local TV or the telephone calls, and we will show you how to utilize them when you're in your room. Please bring your glasses, dentures, and clothing. We want to ensure that you're able to read any education that we're providing for you, but that you're also able to hear us with no issues. Please leave at home any jewelry, money, valuables, credit cards, etc. You really don't need any of those items while you're here. One exception that you may have is if you want to purchase anything through our Walgreens. We have hip kits, which I'll discuss in a few slides, and some other items. So if you do want to purchase one of those items from our Walgreens, we do require that you have a debit card or a credit card with you, but bringing minimal is best. As I mentioned, we have a Walgreens in our main lobby. Most of your surgeons like to send your prescriptions to your own personal pharmacy that you use at home. But if you'd like any other hip kits or any other equipment, or maybe some other medications that the doctors may have changed, our Walgreens would be happy to fill them for you. If you would like to utilize the Walgreens, let any one of the staff members know, or the number is available in your room for you to call. Lastly, as far as the nursing portion, we may give you a bedside survey, and this is simply just to assess any concerns, any issues, suggestions, or maybe compliments that you may have about the nursing staff. This will be provided to you with a sealed envelope, and that will come directly to me, the orthopedic coordinator. When you're home, in a couple weeks, you may receive a mailed survey. This is from an anonymous outside company. You can fill it out anonymously. We would really appreciate if you take a few moments to fill that out and let us know your experience, or if there's anything that we could improve, or maybe things that we're doing well. So we'd appreciate for you to take a few moments to fill that out for us. Next, I'm going to move on to the role of the case manager and the social worker. So their lucky role is to keep in touch with your insurance while you're here in the hospital. So your surgery has been authorized through your insurance company, but your stay, any equipment you may need, or anything that you need once you're discharged from the hospital has to be approved by your insurance. We determine your length of stay based on how you're doing with physical therapy. We do interdisciplinary rounds, which means we have a physical therapist, the charge nurse, myself, case management, and social work, all joined together in the morning just to ask and talk about any challenges that you may be having or your progress in your recovery. Our goal of discharge is certainly to get you home. Most of our patients do extremely well at home, and we're about 95% being discharged to home. There are still occasionally some patients who need to be discharged to rehab. Most likely these patients are someone who's been utilizing an assistive device before coming in for surgery. So someone who's been utilizing a wheelchair, someone who's been utilizing 100% of the time a walker prior to coming in, someone who lives alone, maybe on a second-story apartment who has no elevator and has to go up 24 stairs. So this is a patient that have to go to rehab. If this is the case, it needs to be approved by your physician and a suggestion or recommendation from physical therapy. If this is the case for you, our case manager and social worker will work on checking your insurance benefits, and they will also set up the transportation from the hospital to the rehab facility. They will actually come to your bedside and see what place you would like to go to and make those phone calls and those arrangements for you. Please keep in mind, most patients are not going to rehab. Most insurances, if you're having a total knee replacement and a total hip replacement, either or, they will not authorize you going to a rehab facility. This is solely based on your challenges at home and your progression while you're here. So if you have any questions about this, you can call me and I would be happy to speak with you a little bit further regarding that. Also, if you were injured at work and that's why you're having the surgery done, please bring in your workman's comp information. Most typically, if you are a workman's comp case or if you're under a case provider, you will have a case number, but also a phone number as a case worker. So bring those items in with you so that if our case manager or social worker need to contact them, they're contacting the correct person. Also, there are many patients that have many different types of insurance and insurance benefits. So if you would like to call your insurance, these are 3 questions that we recommend you asking prior to your joint replacement surgery. So number 1, do I have a benefit for an inpatient skilled nursing facility? Basically, this is that small percentage of patients that go to rehab. So if our therapists recommend that and your surgeon has given the okay and the order, do you have a benefit to go to a rehab facility? Number 2 is, do I have a benefit for durable medical equipment? That's the umbrella term for walker, commode, raised toilet seat. So if you need these items, which you will need a rolling walker after your surgery. Do you have a benefit for that? Or is this something that you should purchase before coming in? Number 3, do I have a benefit for a visiting nurse or a physical therapist? There are times when patients are cleared to be discharged to the hospital because we're deeming that they're safe to walk around their own home, to do everything they need to do every day, to do their exercises at home. But perhaps the only family member that you live with has to work all day or has odd working hours, and you're going to be home alone most of the day. Um, Physical therapy and your doctor may recommend that you have a physical therapist that come to your home or a visiting nurse that come to your home. Now, again, this has to be recommended by your doctor or the physical therapist, but you want to make sure that you have a benefit. Some insurances will require that you pay a copay every time this person comes out to your home. And sometimes you don't have a benefit, so you'd have to pay out of pocket for this. So of course, our case manager and our social worker would find out this information for you, but it's definitely beneficial to call your insurance and have this information prior to coming into the hospital. Next is physical therapy. So first, we're going to discuss physical therapy while you're here in the hospital. So our inpatient physical therapist will come to your room and work with you one-on-one in your room. And basically, they want to begin your journey to recovery with bed mobility. So how do you get in and out of bed? How do you transfer from a sitting position to standing? How do you get in and out of a chair? What's the correct way to use a walker? How do you go upstairs? How do you get in and out of the car so that you can travel back and forth to either your doctor's office or your physical therapy appointments? If you do have a walker or have obtained your walker before coming into the hospital, please leave that walker at home. Sometimes it's beneficial if you know who your ride will be that day to actually fold up that walker and leave it in the vehicle or car that's going to be picking you up. So actually leave it in the trunk or leave it in the back seat. So when they come to pick you up at the hospital, you have it once you get home. We actually have a walker in every room that you can utilize here. So there's no need to bring that walker in with you unless you need it to walk into the hospital, of course. But we have a walker in every room that you can utilize here in the hospital during your stay. Our goal is to get you home, of course, but ideally we need to make sure that that's a safe discharge plan for you. So what to expect the same day of your surgery? Gone are the days where we let you relax in bed for a couple days and then get you out. We actually get you up and moving within a few hours after your surgery. Early ambulation reduces any risks of complications, so it's ideal that we get you up and moving. The doctors don't put in the Foley catheters anymore, so the first trip that patients usually want to do is get back and forth to the bathroom. And of course, you'll be doing that with the staff assistants. Our physical therapist will also ask you questions such as your home environment setup. Is it one floor or two floors? How many steps do you have to entry? What are your needs for equipment? What are your goals? What are the things that you weren't able to do that you want to get back to doing? And they want to make sure that the discharge plan for you is safe. They're familiar with lines and drains and those compression devices, so they know how to disconnect them and get you up and moving. They also coordinate very well with the nurses. They will consult with your nurse to make sure that you're comfortable, make sure that you've had something to eat, and that you're ready to get out of bed and start moving. If you stay with us overnight, the next morning our physical therapist will come and see you and actually take you into our physical therapy gym. So after we've attended those interdisciplinary rounds and talked about your challenges and your obstacles at home, physical therapy will come right to your room and get you up and moving. They will be working jointly with an occupational therapist. So the focus for physical therapy is strengthening your joints, teaching you how to walk a normal gait again. Our occupational therapists actually focus on bathing and dressing. So how do you do those items after you've had a total hip replacement or a total knee replacement? They'll be working together. They'll actually take you into our physical therapy gym, which is our next slide. So this is a picture of our Joshua Har Shane Rehabilitation Room. It's actually located in the center of the orthopedic unit. As you can see, we have a car, we have a small flight of stairs, we have a flat mat to simulate getting in and out of bed. In the background there are a couple doors. One of those doors leads to a simulation bathroom. So there's a bathtub, so you can actually practicing getting in and out of the bathtub. And how would you do that? Do you go in with your surgical side or your other side? So our therapist will teach you that. If you're able to do the therapy in this room and then walk back to your room and you're not dizzy and you don't get lightheaded, that's how our therapist would know that you are cleared to go home. Now, there are 3 discharge possibilities when you leave the hospital. Again, this is the small percentage of patients who live alone, a second-story apartment, are walking with an assistive device prior to having their hip or knee replaced. This patient may most likely have to go to a rehab facility. Our case manager and our social worker will set up all the arrangements for this. They'll set up transportation. The typical length of stay in a rehab facility is 3 to 5 days. Don't worry about acute or subacute. Our case managers will take care of that. But I just wanted to let you know that they'll actually set up this transportation and make up the arrangements, and let you know what day you'll be discharged and all the arrangements that have been made. Some patients, when they're discharged to home, they have a physical therapist come into their home. Now, the physical therapist would come out 2 to 3 times a week. They will teach you exercises to do in your home. They will ensure that you have a safe setup at home and a safe environment. And they're going to want you to do your exercises or the exercises that they're teaching you on the days that they do not come. It's really important that you keep that joint moving, that you keep mobile and walking, but also to do these strengthening exercises on the days that they don't come, so that when they come again later that week, they're able to review those exercises and move on to the next exercises for you. The most common discharge plan is our outpatient physical therapy. So this is a patient who would have transportation from their home to a PT center or place and then be able to be picked up to be taken back home. This is basically that you're not considered homebound, that you're able to walk those distances to get into a physical therapy rehabilitation center. Most of the physicians or surgeons are okay with you starting this within a week of your surgery. You would have to make the appointment at any outpatient center that you'd like. I often say if you've been to a PT place before and it's close to your home and it's convenient for you and your family to get there, go back to that place. You don't necessarily have to go to any center associated with your surgeon's office or one that's associated here with our hospital. So go where you've been before, where it's convenient for you. Here is some information on the 5 Robert Wood Johnson outpatient physical therapy centers. There's one in Hamilton, there's one in Columbus, Ewing, 2 in Lawrenceville, one on the corner of Franklin Road. You can visit the website below or actually ask any one of our staff members or physical therapy members. We can also help you get an appointment if you're interested in attending one of our centers. Now, this is just for my hip replacement patients. After you have a total hip replacement, there are 3 rules that we're not going to want you to break. We also call them hip precautions. So the reason being is after you have a hip replacement, all the ligaments and muscles have been moved out of the way, and you want to give that time to heal and strengthen before you're putting that area under any stress. So the 3 things that we're not going to want you to do after your surgery is, number 1, we're not going to want you to reach down and touch your toes or bring your knees up to your chest. That is breaking the 90-degree rule, and it puts stress on the hip joint. Number 2, we're not going to want you to cross your legs. So we're not going to want you to cross your surgical leg over your other leg. So if I had my right hip done, you're not going to want to cross your right foot over your left leg. And so a reminder for this is when you wake up from surgery, you'll have a large, soft, triangular pillow in between your legs, and your legs will be lightly Velcroed in. And so this will be a reminder for the staff, 1, to turn you appropriately, but also for you that when you go to try and cross your legs, you won't be able to. The final one is please do not pigeon toe or twist over that operative side. So again, if I had my right hip done, you're not going to want to twist over to that side. So when you're turning in that direction, you want to pick up your foot and turn that way. We will go over these 3 rules with you. We will make sure that you're able to say them back to us. And again, you'll be able to take that large pillow home with you as a reminder when you're resting or sleeping to not cross your legs. Now, I'd mentioned the items or the term hip kits. So what a hip kit is, it's a bunch of gadgets that will help you after your total hip or your total knee replacement. So in that kit is a reacher or a grabber. There's a long shoe horn. There is a sock aid to help you get your socks on and off. There's a long-handled sponge for showering. Hip kits are available online. They're available on Amazon. We also have them in our Walgreens as well. Is it necessary? Not for everyone, but if these gadgets are something that you feel would be helpful for you, or your friend or your cousin had one when they had their surgery and they were helpful, let us know. You can shop for it before your surgery, or we can let you know the information to obtain one from our Walgreens. Unfortunately, this is not something that's covered by insurance, so this would be an out-of-pocket charge. But if you want some more information, I'd be happy to discuss this with you. So some patients have a benefit of a prehab, and this is something you'd have to ask your insurance as well. So these are learning the exercises and doing the exercises and actually seeing a physical therapist before even coming in for your surgery. There are some exercises that we're going to teach you after your procedure, but learning them ahead of time and starting them ahead of time will help build up those muscle groups before you come in. It'll help strengthen those muscles around your joint. So I've included those exercises that the physical therapist will share with you, and a little description underneath each of them on how to do them. Now, I purposely did not include how many times you should do them or how many repetitions you should do. And this is because everyone's starting at a different baseline. So if you could do these once a day, wonderful. If you can do them twice a day or more, even better. The idea is you want to keep your joints moving. You want to keep these muscles active as much as you possibly can. So if the heel slide is too difficult for you and these ankle pumps that I went over are a little bit easier, then do just the ankle pumps. As long as you keep those joints mobile and keep those muscles mobile and keep it moving, it'll be much more beneficial and you'll heal a lot better after your surgery. Next, we're going to discuss food and nutrition services. So we have actually food service on demand here. We'll provide you with a menu. Please don't get mad at your nurse. It's your surgeon that orders your diet. So depending on the diet that your surgeon orders, your nurse will bring in a menu. And you are able to call on your phone. You dial 5555 and order before every meal. This is able to get you back on your schedule of when you're used to eating at home. You can make the selection when you can see what you're up to or what you feel like eating at that time. It takes roughly about 45 minutes from the time that you place your order. We start taking breakfast orders at 7 a.m. and we ask that you make your last dinner time order by 7 p.m. Again, it gives you the flexibility to eat or to choose your own meal times. My favorite part, we actually order or we provide breakfast foods all day long. So if you'd like to order a special order omelet with cheese and peppers, you're able to do that at any time during the day. Now, if you don't wish to call, if you feel it may be troublesome to have to call, we can give you a sheet which will allow you to order breakfast, lunch, and dinner on that sheet. Or if a family member is here, they can certainly fill out this form for you and we can fax it down to the kitchen. We just ask that you indicate what time you would like each tray delivered. Now, with the important side of food is the nutrition. It's really important that you're making good food choices after your surgery. You want to make sure that you're eating foods that are high in protein, but also high in nutritional value, such as vitamin C and things like that. So if you'd like to see a registered dietitian, you let us know. We can have one come to your bedside. If you're a diabetic, we're going to be managing and watching your sugars very closely because that's very important during the healing process after a total joint replacement. If you're a type of person that doesn't have much of a great appetite or likes to have an Ensure or Glucena or a health shake after every meal, let us know. This is something that we can have ordered on your tray and it could come up at every meal time. We try to accommodate as many food preferences as possible. We just want to make sure that's ordered within the diet order that your physician makes for you. For instance, if you have high blood pressure, we're going to want to watch how much salt intake you have during your stay here. So your diet may be a lower salt diet. If you have any questions or concerns about your meal choice or the diet order that you've been placed on, please let your nurse know. Now, the last leg of this presentation is pharmacy. So we're going to discuss some medications that you may not be used to being on, but are very common after a total joint replacement. So we're going to hit the antibiotics first, the blood thinners, and of course the pain medication. I'd like to mention that it's very important for you to tell your doctor or nurse about any medication allergies or food allergies that you may have. So you may or may not know, patients who tend to be allergic to avocados or bananas may have a tendency to be allergic to latex. So that's something that really important that we need to know. So please let us know about any medication or any food allergies and what type of reactions you have if you have that medicine or that food item. The drug of choice usually given after a total joint replacement is a medication called Ancef or cefazolin. It is most commonly used. However, if you do have a penicillin allergy, there are different antibiotics that we can utilize. You just let us know and we'll choose one of those other medications for you. This medication is given before your surgery, and you're given 2 to 3 doses after your surgery, and then that's complete. You do not have to take any antibiotics when you're home or be discharged with any type of antibiotics. I do like to mention that after a total hip replacement or total knee replacement, in the future, if you need any um, invasive dental work done, for instance, if you need to have a root canal done, or you have to have a tooth pulled, or some type of oral surgery, your orthopedic doctor may want you on an antibiotic for a few days before you have this dental work done. So what you're going to want to do is simply call your surgeon. Let them know I have to have this dental work done. Do I need to be on an antibiotic? And they can call something in for you. Just a little side piece that's really important that I like to let my patients know. So blood thinners, let's discuss about blood thinners after surgery first. So after a total hip or total knee replacement, you're more at risk of getting a blood clot. That could be a potential complication after a blood clot. Your medical history may make you more likely or a higher chance of getting a blood clot. Example of this would be patients who maybe have had a past stroke, patients who have blood clotting issues, patients who have had cancer or malignancies before, patients who have an irregular heart rhythm or AFib. If you've had any one of these in your medical history, your doctor may put you on a blood thinner that's a little bit stronger. So maybe something like a Lovenox, Coumadin, Xarelto. There are many different types of medications that they can choose from. Also, if you're at a low risk, your doctor may simply put you on an aspirin, 325 milligrams twice a day, or 81 milligrams, simply a baby aspirin twice a day. So we will start that here in the hospital. We'll let you know exactly what dosage you need to take, and we'll let you know exactly how you need to continue it at home. If you're coming in and your cardiologist has said, you've been on a blood thinner, and your cardiologist says to stop it a couple days before your procedure, your surgeon will restart that same medication after your procedure. So for example, if your surgeon has told you to stop your Plavix 7 to 10 days prior to your joint replacement, your surgeon will let you know when it would be safe to restart your Plavix after your surgery. So if you are on a blood thinner, your surgeon will not change it for you. They'll simply tell you when it's a safe time to restart that medication. So let's talk about blood thinning agents prior to having your surgery. So before your surgery, okay, you should be stopping any medication that's considered a blood thinner. Now there are various types. There's a lot of different types of these medications. And 7 to 10 days or 5 to 7 days is usually the window that you want to stop. But what all your surgeons recommend is that you speak with your cardiologist or the doctor that has placed you on the blood thinner. So examples of these medications are Plavix, ginkgo biloba, vitamin E that's over 400 units, omega-3 fish oil. I've even heard supplements such as turmeric, garlic, cinnamon, saw palmetto. Any one of those supplements or medications, you want to consult both your surgeon and the doctor that has suggested you take that medication and ask them when it's a safe time to stop so that you don't bleed too much before your surgery. Some other medications that you may be taking for pain could also thin your blood. So you definitely want to speak to your surgeon and ask, when should I stop taking aspirin, Advil, Motrin, ibuprofen? Aleve, naproxen or naproxen, Mobic or meloxicam. All of those medications are considered in the anti-inflammatory family. A lot of the times, a lot of you are taking those for pain, but you don't want your blood too thin prior to coming in for surgery. So consult your surgeon and ask them when it's a safe time or when you should stop taking these medications for pain before your surgery. As I had mentioned before, if you're on any blood thinners for any other reason, so Coumadin, Xarelto, Eliquis, Pradaxa, Savasa, if you're on any of those medications for any medical history reason, you want to consult the doctors that has prescribed that medicine to you and ask them when is a safe time to stop it before you have your joint replaced. The biggest question I get from my patients is how much pain am I going to have prior to my surgery or after my surgery? So you'll hear a lot, it depends. Patients tolerate both medications differently and they tolerate pain differently, but we're going to try and plan your medication based on your history and based on your pain tolerance. So you need to let us know what you're taking prior to coming into the hospital. Someone who's never taken a narcotic prior to coming in the hospital may be very sensitive to those medications, and they may have built up a tolerance to those medications. So please let us know what you're taking at home prior to coming in. We also do something that's called a multimodal approach. So what we'll do is give you different types of medications that work on different type of pain receptors in the body. And we'll be giving you something every couple hours to stay ahead of the pain. So research shows that if you give these type of medications prior to the pain, the onset of all that pain, patients are managing their pain, they're working with physical therapy better, they're walking further, so they're doing really well. So we will make this multimodal regimen or pain cocktail based on what you're used to taking, based on your body and what you can tolerate. You'll also see this pain management scale in your room. So you'll see this pain rating face scale. It starts with 0, so I'm having no pain at all, I'm not hurting at all, and 10 is the worst possible pain you've ever felt. The nursing staff will ask you to rate your pain very frequently. The reason why they're asking you to give your pain a number is because we have medications or what we call on standby or as needed. So the stronger medications are on an as needed basis. So we have that formulary, so that cocktail that we're going to be giving you every couple hours. But if that cocktail is not doing it, if you're still having a little bit of pain and you let your nurse know, for example, I'm at a 6 out of 10 for pain, that is considered moderate pain. So they will go to the orders from your physician and bring you the medication that is due when you're having a 6 out of 10 with pain. Please let the nursing staff know if your pain medication is not working. If you're having side effects such as dizziness, nausea, itching, if you're hallucinating, we want to make sure that these medications are working for you while you're here in the hospital, because these are the medications that you're going to be discharged on. So we want to know that you, 1, are able to tolerate them, and 2, that they're working for you to help control your pain so that you can walk, you can do your therapy, and you can recover better. One of these side effects or common side effects of pain medication or narcotics is constipation. We will be encouraging you to increase your fluid intake and your dietary fiber while you're here in the hospital. The doctors often will order a stool softener as well to be given twice a day. If you need something stronger, if you're a patient who tends to get constipated, you can let us know and we'd certainly put something stronger on your pain medication regimen, and we'll have your doctor order that for you. As I had mentioned earlier in this presentation, there will be a nurse calling you on the business day before your surgery. That nurse will go over where to go to come in when you come in for your surgery, what time you should be coming, what time your surgery will begin. That nurse will also go over what medication should I take the morning before my surgery. Some of your surgeons and anesthesia have discussed there are certain medications that we want you to keep your body on the normal schedule, which is usually thyroid medication, some blood pressure pills. If you are a diabetic, we do not want you taking any oral or pill diabetic form medications prior to your surgery. You won't be eating for a number of hours, and so you won't want to take those diabetes medications because we don't want your blood sugar to drop during your procedure. That being said, it's good to know also for diabetics that your blood sugar may run slightly higher after your surgery. Surgery can be stressful on the body, and so sometimes our diabetics are surprised when their sugars are running a little bit higher, but we often do see that. Ideally, we want to keep your sugars below 180. So research shows the higher a diabetic runs at 180, the more likely they may be for a post-operative infection. So it's really important. We're going to discuss with you the importance of keeping your sugar at a safe range, but also how to do so while you're home. We've just instituted what we call an ERAS, Enhanced Recovery After Surgery. So this is those surgical drinks that you received or the orders to get a Gatorade bottle for preparation prior to your surgery. So just in review, the midnight before your surgery, you're going to want to drink either 2 bottles of the Ensure that we provided to you, or one 20-ounce bottle of Gatorade. It should be the G2 for diabetics, anytime before bedtime or before midnight before your surgery. In the morning when you wake, you can drink that 3rd bottle of Ensure, so 1 bottle of Ensure, or another bottle of the G2, that's 20 ounces, right before leaving for the hospital prior to your surgery. What research shows is that these drinks, so carb loading or your body having some carbohydrates before you coming in for surgery, actually tricks your body into thinking that you've eaten. It keeps the GI system moving. It actually helps patients with making sure they don't have low blood pressure after surgery. There's a lot less nausea and vomiting after surgery. So these drinks are ideal. Again, if you have any questions about this or you have some concerns or you'd like me to review it again, just give me a call. I'd be happy to go over that with you. So should you bring your home medications in from home? Usually the answer is no. Our hospital pharmacy will supply you with the medications during your hospital stay. If we do not carry a certain medication, we may ask you to bring it from home. Some important facts about that. We need to make sure that you bring it in the pharmacy bottle. So we can't have it in one of those strip containers the Sunday through Saturday. It has to be in the medication bottle that's given to you by your pharmacy. We will actually lock it in a medroom in a drawer. We will provide or administer that medication to you, and we will return that medication to you once you're discharged. Please do not take any medication at your bedside from home without the staff knowing. If you have any questions about the medications that you're on, we can have a pharmacist come to your bedside and discuss that with you. So this actually concludes our total joint pre-surgery education class. I've included my name, my number or my work number, but also a cell phone that you can contact me with any questions or concerns that you may have before coming in for your total joint replacement. I also have included my email, so please feel free to reach out to me in any form. You can call me, you can text me, you can email me. I'd be happy to answer any questions or concerns you may have. So thank you for joining our total joint replacement class, and I'll look forward to meeting you when you come into the hospital. Thank you.